All right, so this is part 2 of bones and surface landmarks. And we ended with this slide, so let's go ahead and start with the new slide. And here we see we're going to start with the vertebral column. So the vertebral column has 24 vertebrae. If you'll remember from the previous slide, we have 7 cervical vertebrae, C1 through C7. And then we have 12 thoracic vertebrae, and then we have 5 lumbar vertebrae. So 7, 12, and 5 equals 24. So that's what makes up our 24 vertebrae. They are separated by intervertebral discs, which is kind of just some soft, spongy, flexible material in between the bones. The vertebral column supports the head, and our head has some weight to it, and so it's got to have the column has to have some strength to it. And so it does have some good strength in the bone structure. So it bears the weight of the upper body. It also protects the spinal cord, and which is important because our spinal cord has a lot of nerves running through it. And then also the vertebral column, each one of those discs, those 24 different vertebrae, allows for some movement. And a little bit of movement in between each of those joints totally allows for a lot of movement. So we can bend forward, we can bend backward, we can bend side to side, you can twist. So it allows for a lot of movement when you have that many vertebrae and they all move a few degrees. Then it adds up totally that your body can move many degrees. All right, there's 4 regions. We talked about the cervical region, 7 bones, C1 through C7, thoracic, 12 bones, and lumbar, 5 bones. And then at the bottom, at the end, there's the sacral region, which is holds the sacrum and the coccyx. Now, as artists, we want to take a look at how do these bones, what can we relate them to that will help me in my drawing? So here we can see the atlas vertebra, that is called C1. Here's a 3/4 view of it, posterior superior view. And it's very similar to Atlas holding the world on his shoulders. And so we can see the angle there of this particular bone and the angle of the arms of Atlas as he holds up the world. And then down here we have the axis, which is C2. And C2 kind of looks like a saddle tree when which you would notice for when you're riding a horse. And you would put the saddle on this. So anyway, so here's the atlas and the axis. 2 bones, one sits right on top of the other, but they're 2 very different looking types of bones, and they serve different purposes. All right, the next one is going to be the lumbar vertebrae, which is at the bottom, and L1 through L5 here. And if you'll notice, they're thick, and they're much thicker and they're much larger than the cervical and the thoracic vertebra. And that's because they're going to, as you get further down, like the cervical vertebrae are only holding the weight of our head. And then as you go down further through the thoracic vertebrae, now they're holding the weight of the head and the arms. And then as you get further down, they're holding the weight of the head, the arms, and the torso. And then as you get further down with the lumbar, you're holding the entire weight of the entire upper body. And so because there's more weight, then they should be bigger and stronger. And so anyway, the lumbar vertebrae, when you're drawing them, they kind of resemble a Greek column, as you can see here, one stacked on top of the other. And here you can even see there's a good view of the discs that we mentioned that are in between each of the vertebrae. All right, the next ones. We see here's the sacrum and an anterior view. And the sacrum kind of looks like the head of an elephant with its ears outstretched here. And so here we see the ears kind of the sacrum right there, the sacral horns on either end there, the transverse ridges in between here, the anterior sacral foramina, which is these are actually holes in there, which nerves and blood vessels run through these holes. And then at the very end, we see the coccyx right down there. So the sacrum resembles an elephant's head. Here we see the thorax region, the thoracic region of the rib cage, an anterior view. And here we can see that there are 12 pairs of ribs. And in the rib cage, there's different names for these. So if you'll notice, we have 7 true ribs. 1, 2, 3, 4, 5, 6, 7. And they're called true ribs because each one of these pairs of ribs, they attach directly to the sternum. And here we have costal cartilage, which is right here. But 1 through 7, they connect directly to the sternum. And then we have these false ribs down here, 8, 9, and 10, and they're called false ribs because they don't connect directly to the sternum. If you'll notice, 10 connects to 9, 9 connects to 8, 8 connects to 7, and then 7 is the last of the true ribs connecting directly to the sternum. And then we have 2 pairs of floating ribs, number 11 and number 12 there. And so you can see they're not attached to anything. They're just floating there, and that's why they're called floating ribs. And you can actually feel those. Be careful. You don't want to tug on them. You don't want to pull, but you can feel every one of your ribs all the way down and count them. And then this area here in the thoracic region, this is called the thoracic arch. And again, I mentioned the way that the bone of the ribs connects to the bone of the sternum is through costal cartilage. And what happens is this cartilage actually has some flexibility. Remember we talked about the nose has cartilage in it, and that's kind of flexible. This allows for a little flexibility as well, so that when you take a deep breath, you breathe in, then it allows your ribs to expand just a little bit. It allows for those deep breaths you take. So it allows for your torso to move in and out. And also another great thing about flexibility with our bone structure is that bones are very rigid and they only have very minimal flexibility. So this cartilage allows for more flexibility. Think about a football player. When one player tackles another player and knocks him to the ground, lands on top of him, if we didn't have this costal cartilage here, then areas of these bone, if it was just bone connected to bone, they might snap, they might break because there's not a lot of flexibility in here. And so you should be glad you have cartilage here connecting bone to bone because during sports, roughhousing, playing around, it allows you to be able to be rough, to knock each other around, and allows things like that to happen without snapping, breaking, cracking bones. It just allows for some flexibility in there. So it's a good thing. All right, the next one. We see the sternum here, a good close-up of our sternum, and it resembles the shape of a Roman dagger. And so at the top, we've got some areas here. We have the suprasternal notch, which is the pit of the neck, the clavicular notch, that means the clavicle bone, which we also call our collarbone, fits right inside there. And this whole big piece right here, this is called the manubrium of the sternum. This piece is the manubrium of the sternum. Down here is the angle of the sternum. And then costal notches. This is where the costal cartilage comes into the sternum. And here's the body of the sternum. And then down here at the bottom, this little piece of the bone here, this is called the xiphoid process. Xiphoid process. I know it's an XI, but that has the Z sound. So it's a xiphoid process. Anyway, so that's what this the sternum resembles, is a Roman dagger. You can kind of see how it resembles the shape there and even comes to the point at the end. All right, next, the shoulder girdle of the rib cage. So we saw at the top of the manubrium there where it had that clavicular notch. Well, our clavicles, we have 2 clavicles, also called collarbones, and we also have 2 scapula, which is our shoulder blades back there. And this shoulder girdle of the rib cage, once the clavicle is attached to the manubrium on one end, on the other end of the clavicle, it actually comes into our shoulder. And there's this group of muscles. It's a group of bones, of ligaments, all these attachments forming our shoulder girdle. And so that's what this is talking about, the shoulder girdle of the rib cage here. The girdle allows movement of the upper limb, and various muscles from the torso and arm attach into the shoulder girdle to help move the scapula bones, clavicles, and humerus bones into different positions. So very important that it's a whole, the shoulder girdle there. All right, here's a good example. You can see the clavicles or collarbones. Here's where they come into that clavicular notch here in the manubrium, and the clavicle comes around the front, and it hooks here into the acromion process. Here's the humerus down here, and this is our shoulder girdle right here. You can see the shoulder girdle. So that's it on both sides. It's kind of a complex. We'll get more into that later, but it's a complex of many different parts going in there. But it allows for a lot of movement in our shoulder. All right, next we see the scapula, how it resembles a garden trowel. And if you've ever done any gardening, you've probably got one of these around the house. And it's good for digging up dirt, digging up weeds, planting flowers, things like that. But you can see the shape here of the shovel kind of resembles the shape of our scapula. And a couple different places here, the superior angle, subscapular fossa is this region down here. We have the vertebral border down here, the inferior angle, the lateral border, the glenoid fossa right inside there, and then the acromion process, which is where, remember we saw that just on the last slide, where it hooks into the clavicle, and then the coracoid process there as well. So the scapula resembling a garden trowel. Here the scapula is kind of triangle shaped, and you can see all the different parts of it again, and it still looks like that garden trowel. And when you put your arms behind your back, you'll notice that the scapula protrudes out from the body. And so go ahead and try that now, is put one or both of your arms behind your back, and if you're flexible enough, you can actually feel with your hands, you can actually feel your scapula sticking out through your back, or not through your back, but out of the back. And so it gives you a better feel of what that is and where it's located. Now, there are some muscles and other pieces back here we're going to take a look at. So, for instance, we see the trapezius. The trapezius is actually, even though we're talking about muscles, we're talking about bones and surface landmarks, the trapezius is right here. And the trapezius is a muscle that starts down here, and it can even come down here. And it goes all the way up into the neck, right up here. And there's attachment sites right up here at the base of the skull. And so the trapezius is actually a muscle. Here's the border of the scapula. This is the medial border. Remember, medial closer to the midline of the body. And so this is the medial border. The deltoid. The deltoid is also a muscle. It's not a bone, it's a muscle. And so the deltoid is the shoulder muscle. We'll talk more about those during the muscle week. And then the teres major is also a muscle right down here. Inferior angle of the scapula, that's the bottom of the scapula. And then we have a couple places right here. If you'll notice right here, the seventh cervical vertebra, C7, you can feel that. That's actually kind of the bigger bony. If you move your head forward or bow your head down just a little bit and move your hand from the back of your skull down your vertebral column, down your spine, and you'll find that there's one bone that kind of sticks out a little bit, and you can't really count all 7 vertebrae of the C7 all the way from C1 to C7, but you'll get to one bone that sticks out right there. That's your C7, and that's what's being shown here. That is a bony landmark. So remember that C7 is the bony landmark, which you're seeing right there. All right, and then across the picture, we see the medial border of the scapula. Again, medial, close to the midline of the body. Teres major again. There's also a teres minor that we'll get into, which is underneath that. But teres major, it's a muscle. And then the vertebral column coming down through the spine there. All right, bones of the upper limb. And here we see the arm. And here's the shoulder girdle right up in here. Here we see the scapula that we just looked at. Keep in mind this is an anterior view down here. And then remember, anterior meaning front view. So anterior view, here's the greater tubercle. It's just a location on the humerus. The greater, the lesser tubercle, scapula. And here's the shaft of the humerus. Remember, the humerus is a long bone. Then we have the medial epicondyle. Medial, closer to the midline. The trochlea, the capitulum, The ulna is out of the two bones in our forearm here, the ulna is the big one. And remember, the ulna is what has the elbow. And there's the radius. And the ulna also forms, over here you can see, also has that little bump that's by our pinky, that little bone that kind of protrudes out a little bit. That's the head of the ulna. And then there's the elbow, which is actually called the olecranon of the elbow, or the olecranon of the ulna. All right, so what else? The spine of the scapula runs down here, and everything else looks good. Just to go over a little bit, carpal bones in the wrist. What's it called in the ankle? Tarsal bones. So in the hand is carpal and metacarpals, and then the fingers are called phalanges. And then here we see a posterior view. It's a great view of the scapula that we just talked about. Medial epicondyle and the lateral epicondyle, the olecranon of the elbow right there, the ulna, and the bones of the hand. All right, next, bones of the upper and lower arm with the rib cage and shoulder girdle. So here you can see a good look at the elbow when you put your arms. And while we're going through these, it's actually a good idea to get in some of the poses that the pictures show and then feel the bones with your other hand. So if I take my hands and clasp them together and put them behind my head, and then I can take one arm, I'll leave one arm there, and I can feel the olecranon of the elbow there. That forms my elbow. I can feel my humerus, and mostly you're feeling muscles there when you feel your humerus, because it's pretty well protected by muscle in there. But you can feel your humerus, and then following the humerus down, we see there's the clavicle, and clavicles are actually pretty easy to feel in there. They sticking right out by the skin there. The head of the humerus, the scapula, you can't really feel that head of the humerus, and then the scapula that we can see as it comes around. Over here, the radius and the ulna, you can see them separated right here. We're going to find out. Now here in the picture, we're not showing ligaments and things like that in here. And when we're looking at this radius and ulna, it looks like there's nothing attaching these two, nothing in between there, but that's not true. And so there are ligaments that come in between here attaching these two bones together, and we'll talk about those at another time. Anyway, following down, the humerus, head of the humerus, scapula, clavicle again, and then the sternum, costal cartilage, and then the thoracic arch here. So, all right, those are the bones of the upper and lower arm. Here's three views of the humerus, which is a long bone, and the shaft is covered by muscles and tissue. Remember I said it's kind of hard to feel that humerus is because we have the muscle. The muscles that we're most familiar with on the humerus, the biceps and the triceps, right? When people go to the gym, we try to work out those biceps, try to make them look bigger, get them stronger, and the same with the triceps. And so, and those are in the humerus. And the reason we do that is because whenever we do a lot of lifting, if you're moving furniture, moving boxes, just daily work, even helping yourself up out of a chair, off the floor if you're sitting down, whatever, just lifting things, carrying groceries from the store to the house. We do a lot of lifting with our arms, and so we do want our biceps and triceps to have some strength to them. And so you build up those muscles so that we can lift them with ease. All right, so here's what the humerus looks like. Notice there's kind of a ball at the end there of it. That's the head of the humerus. And then we have a couple areas, the greater tubercle, the lesser tubercle, intertubercle groove down here. Excuse me, it's the shaft of the humerus. And then as we get down here, the deltoid tuberosity. And down here, the medial, and again, I know I've said it a couple times, repetition will help you remember. Medial means closer to the midline of the body. Medial epicondyle, lateral epicondyle. And then we have these areas right here that kind of aid in the movement of the elbow down there. So the trochlea and the capitulum down there. All right, very good. Into the forearm. So we're moving down from the humerus into the ulna and the radius. And the radius is always on the thumb side. That doesn't change. And the ulna is always going to be on the pinky side. Remember, we've already talked about the head of the ulna is that bone kind of near the wrist on the pinky side. And then the ulna has the elbow. What do we call that? The olecranon, right there, the olecranon of the elbow. All right, let's take a look at these two bones. So here's the ulna, and we're looking at an anterior view, so we don't really see the elbow there, but we can see this notch right there. And over here we can see it a little bit better. It's called the trochlear notch, and that's a joint that helps our arm to move. But it also, notice it also will limit movement. So when I bend my arm when I bend my forearm or if I make a fist and move it closer to my shoulder and, you kind of make a muscle, then what happens there is we can only go so far. And then when I stretch my arm out, I can only go straight. Now I know some people can go just a little bit further than straight, and they can bend their arm at an angle. And so this trochlear notch probably allows them to do that just a little bit more. It doesn't limit them as much. My arm only goes straight, but some people's can go just a little bit further. All right, let's keep looking. We see the head of the radius down here. It's almost cylindrical in nature, just the head of it. And then the bicipital tuberosity, following it all the way down. The radius, you can see it's a nice long bone as well. And then down here, we see the styloid processes of the ulna, of the radius, down here. Those are just little, remember we said process. If something says process, it's usually a part of a bone that sticks out, and it does that on purpose. That's its function, is to stick out. So here's the styloid process of the radius, styloid process of the ulna in there. All right, let's keep moving on. The ulna resembles a crescent wrench at the elbow joint. So remember, there was that trochlear notch right inside here. That's the part that resembles a crescent wrench. And so it fits in there, and it allows for that movement we just talked about so that you can lift things or make a muscle, but that joint allows for that. And we'll talk about joints. I think joints are next week, actually. So you get a little taste of it here. Next, the elbow. That is called the olecranon of the elbow. And when the arm is straight down, you can see these 2 points right here coming across, the lateral and medial epicondyle of the humerus right across there. And so all 3 of them go across here. But when the arm is bent, it tends to form a triangle there, these 3 bones. And you can actually feel them on your if you take one hand of one arm and you can bend your arm, and you can actually feel all 3 of those areas on your elbow there. And you can feel how it forms a triangle when your arm is bent. And it goes straight alignment, straight across when your arm is straight, when the arm is straight out. Here's an image of a woman with relaxed arms and the corresponding skeletal diagram. And here again, remember we're also talking about surface landmarks, and so that's why we're doing this. These are landmarks that you should be remembering because as an artist, 3D artist, as a illustrator, these are important landmarks to remember. So the lateral epicondyle, the olecranon, the head of the ulna, remember on the pinky side there, the olecranon of the elbow, the lateral epicondyle, and then the same landmarks here showing the skeleton. Here's bones. We're traveling down the arm. We started with the humerus, and then we moved to the ulna and the radius, and now we're looking at the bones of the hand and carpal bones. All right, so here we have the phalanx of the thumb, which is distal. Remember, distal means further away from the torso, and this bone is proximal here, the phalanx of the thumb, proximal and distal. So this one's the furthest away, this one's closer to the torso. Metacarpal of the thumb. These are the metacarpals. We have 5 metacarpals on each hand. And then you'll see the phalanx, distal, middle, proximal, metacarpal heads down here, metacarpal bones, and then the carpal bones in the wrist, the head of the ulna, and then the radius there. All right, so when you're talking about your phalanges, remember distal is going to be the tip. Then we have the middle, and then we also have the proximal. And so if you've broken a finger and you go see the doctor, the way he knows which one it is because he'll say it's either distal, middle, or proximal phalanx, and then he'll designate which finger it is. Or maybe it's the thumb. And then we have the metacarpals here. And if those are metacarpals, then these must be carpals in here. And each of the carpals actually has a name. And so you can see here the corresponding, they've been numbered here, and each one of those bones as well has a name. And you can see them listed here and here. 8 carpal bones that we have in our wrist. Now, I'm glad we have those 8 carpal bones. Think about all the movement that you have in your wrist. So there's a lot of movement, but I also want stability in my wrist. And if all I had was a ball and socket joint in there, I probably might not have as much movement and corresponding stability. So I want lots of movement, lots of flexibility, but also lots of stability. And usually those two things contrast. Usually the way it works is that the more flexibility you have, the less stability you have, and then the more stability usually is the less flexibility. And so there's a balance there. But in the wrist, the ankles, we want both. So each one of these bones works together in order to give us lots of flexibility, but yes, lots of stability and strength as well. All right, here's the study of a hand with a guitar and a skeletal diagram. And here you can see the hand is playing guitar. The tendons are sticking out here as they move across the bone. You can also see some veins, and you can look at your own hand and see the tendons sticking out in the veins, and as they're in your hand as you look at them. Your veins should be blue or bluish in nature, purplish bluish in nature, and the tendons are just going to roll across the skin. As you move your fingers, you'll be able to see them, and they look like straight lines or maybe very thin pencils that are under your hand. All right, here we can see carpal bones, and here radius ulna, the head of the ulna, which means this must be the pinky, right around here. And then we can see 4 fingers. So these are carpals, metacarpals, and then phalanges. Now this says PIP joint. It's not actually a PIP joint. The PIP stands for interphalangeal joint. And so it's the interphalangeal. So this is I think that's proximal interphalangeal joint. That's what the PIP stands for. And then the MCP is the metacarpophalangeal joint there, metacarpophalangeal joint. So it's just easier to say MCP, and it's easier to say PIP or PIP joint. Either one's okay. All right, here we have the pelvis, and a very unusually shaped bone. It's not a long bone. It's very unusually shaped. But let's look at it because there's different surfaces and different locations. Here we have the iliac crest, which we mentioned a while ago in the first video, that you can feel the iliac crest. You can kind of follow it. You can feel it on your waist there. And remember, that's the thing, that when you wear a belt, your belt kind of hangs off that iliac crest and keeps your pants from falling down. Then the asis is this area right down there on there. It's kind of like the tip of the iliac crest at the bottom. And then this whole area here is called the ilium. And then down here, corresponding, that's the ilium. Down here we have the ischium. And then in between, we have the acetobulum in the hip socket right inside there. And then we also have the sacrum, the coccyx. And then right in between here, this is some cartilage in here called the pubic symphysis. And it's a little bit of cartilage right inside there, which allows for some flexibility. And again, if you're roughhousing, playing, or if you happen to fall on your side, you want some flexibility. You don't want your pelvis to break. You want it to bend a little bit and to have some flexibility, so that there's no damage. And also through childbearing. And so we want some flexibility in there. So this is the whole pelvis, and these are the areas that are named on it. So we can see this is the pubic bone down through here, and here's the obturator foramen. Again, blood vessels and nerves go through these holes that are in there and go through these holes that we saw earlier. All right, let's move on. Let's look at the next one. The next one, the pelvis resembles a fragmented bowl. And I know this can be a stretch sometimes, like the author's just trying to come up with something, but this is what the author uses to remember what the shapes look like. It kind of helps in doing that. So if you don't like the fact that it looks like a fragmented bowl, what do you think it looks like? Come up with something, any bone parts, and think of something that helps you to remember what it looks like. This is just what helps the author to remember this. So here's a good 3/4 view of the pelvis, and showing you that it kind of resembles this cracked, fragmented bowl here. All right, study of a male pelvis and the legs. And so here we have the anterior and posterior view of the male pelvis, and we also have the corresponding image with seeing the skeleton inside of them. Now we have these things called flank pads of the external oblique here. Flank pads, we like to call them a more affectionate name. We call them love handles, right? So flank pads, we call them love handles. But remember that there are also surface landmarks in there. Notice that they kind of form a straight line in line with the belly button there. There's the acis. Remember we talked about the acis is the bottom line of the iliac crest there. So the flank pad is coming out there because there's some flesh on it. If you look over here, here's that iliac crest right around here. And at the bottom is the acis. And if we come over the corresponding, it's sticking out just a little bit right there. Here's a ligament that comes down right inside here, the inguinal ligament. Over here on the posterior, we see the iliac crest, again on the pelvis, that's going up there, forming that. The sacrum right there, the coccyx is going to be down here. And then we have this area, it's a little depression right in here. It's called the depression near the greater trochanter. And then your greater trochanter, you can actually feel that if you just kind of stand up. It's easier to feel it if you stand up. And you can actually feel that if you move your leg a little bit, you can feel that where the femur, the greater trochanter of the femur is right there. And then the same thing on these on the pieces over here, but it just shows you the corresponding view of these same pictures. All right, here's a study of the female pelvis and the legs. Again, we see the flank pads, both the anterior and posterior views of the flank pads there. And there's this little area right there, the pieces right inside there. There's the sacrum, and again, here's that inguinal ligament coming down through there. And here on the skeletal region, we can see the greater trochanter, and that's also sticking out. The greater trochanter sticks out right there. You can see just a little bit right there, even though it's not labeled. Again, the pubic arch for flexibility, and the femur. So anterior and a posterior view. Here are the bones of the lower limb. So we've looked at the skull, the cranium. We've looked at the torso, the arms. We've looked at the pelvis. And now we're moving down into the bones of the lower limb. Here you can see, again with the pelvis, we see the acis here at the front. The piscis was at the back. The iliac crest, which we said you can feel, hold your belt up there, the pelvis. Now let's move down. There's the greater trochanter and on the femur, and you can feel that greater trochanter if you stand up there and kind of feel around on your leg up there by the pelvis. Here's the femur, a long bone, and the femur is the largest bone in the human body, and it's also the longest bone in the human body. Here we have the lateral condyle of the femur. Lateral, does that mean it's closer to the midline or further away from the midline? Right, further away from the midline. If it's closer to the midline over here, it's called the medial condyle. So lateral is further away. And then we have the patella. Here's a nice lateral view. We see the patella or the kneecap, lateral condyle of the tibia, tibial tuberosity, and the tibia. And then down here in the hands, we had carpal bones. Down in the ankles, we have tarsal bones. Metatarsal bones, which are kind of like the hand bones, but these are the foot bones, metatarsal bones, and then the phalanges, which are our toe bones. We also have this lateral malleolus right there. That's that bone of the ulna that comes down and forms that little notch right there. You can feel it on your ankle. And then the calcaneus, which is the heel bone. And then over here we have a nice anterior view. I won't go through all these. We've kind of looked at them and see if there's anything new there. Oh, we have the medial malleolus here. So we have the lateral malleolus over here, the lateral malleolus over there. And you can feel those bones on your ankle, both sides. And then over here we have a posterior view. We know that because there's the sacrum. And a couple areas. There's a line going down the femur here, the back of the femur, the linea aspera. And then we have the intercondylar fossa It's just a little notch in there, which allows for movement in there. Medial condyle, there's the lateral condyle, the head of the fibia, medial condyle of the tibia. There's the tibia, we see the back of it. And then the lateral malleolus, the medial malleolus, the talus, and then the calcaneus. That's your heel bone, remember? All right, let's look a little closer here. The head of the femur kind of resembles a golf ball. And there's the greater trochanter. That's what we can feel. You can't feel the head of your femur because it's actually inside your pelvis. It's inside the hip socket in there. And it forms a little ball and socket joint in there. But you can feel that greater trochanter. Here's the neck of the femur right there. And then the lesser trochanter is down here. You can't feel that because that's medial. It's inside towards the midline. Now, the condyles of the femur kind of resemble a pair of casters. So they're almost cylindrical in shape. And remember we said there's this little area right inside there, and to allow for some movement. Next, here's 3 different views of a femur. And here's the head of the femur, resembling the shape of a golf ball. The greater trochanter, the neck of the femur, the lesser trochanter. Here's the shaft of the femur. The patellar surface, that's where the patella, the kneecap, moves across this surface here. And then we have the intercondylar fossa and then the medial condyle as well. So a couple different views of the femur. So here's the patella. The patella or kneecap resembles a scallop shell. And so it's not that large, and it kind of protects the knee joint in there. Protects that whole knee joint. We can see it right here. And it is attached through these 2 tendons. The tendon of the quadriceps and then the tendon of the tibia here. The patellar ligament is what is going to attach it here. Here's the femur coming down from above. And then down here we see we have the fibula and then the tibia. And so and how the kneecap kind of covers this joint right there. And it is possible if you're playing sports, it is possible for this tendon or this ligament to become detached, and you can have a floating kneecap, which I understand is can be painful, and it just kind of throws off. You'll walk with a limp, and it's not a real fun thing to have to deal with. So anyway, there's the kneecap. The tibia and the fibula. So we have the radius and the ulna in the forearm, and in our leg, in our lower leg, we have the tibia and the fibula. Try not to get those 2 confused, or those 4 confused, I guess. Up here, we have the medial condyle of the tibia and the lateral condyle of the tibia. So if we're looking at this, if this is the medial, that means that this must be the left leg, and it's anterior because it's facing us, and so this is closer to the midline. Tibial tuberosity there. You can actually feel that tibial tuberosity on your tibia there. Then the tibia, you'll notice this line. It's not perfectly straight. It kind of curves a little bit. You can feel that line all the way down your leg, the anterior border there of the tibia. And then you can feel that medial malleolus, and you can feel that lateral malleolus as well. Here we have the head of the fibula. Here's the fibula, that smaller bone. Sometimes football players, when they break a bone in their leg, and many times it will be this fibula, this smaller bone in the leg. Doesn't mean they break their femur or it breaks this, that big bone. Doesn't mean they break the tibia. A lot of times the broken bone is going to be this smaller bone right here, this fibula. It's much thinner. And if you're familiar with the football player Terrell Owens, he played football for the Eagles, 10 years ago. The Eagles went to the Super Bowl, not back this year, 2018, but years ago. I don't even remember how many years ago it was, 7, 8 years ago, maybe even 10 years ago. But Terrell Owens, in the playoffs, broke his leg. He broke his leg. What he broke was this fibula, cracked it. And bones take 6 weeks to heal. Well, Terrell Owens was their best wide receiver, and there was no way he was going to miss the Super Bowl because he helped get him there. So he cracked it. They healed it. He didn't play for 5 weeks. but he did not wait the full 6 weeks. It was in the 6th week was when the Super Bowl was, and he played in the Super Bowl. And even though the Eagles lost, he still played hard, did a good job, scored a touchdown. I believe he scored a touchdown, and played before his leg had waited the full 6 weeks to heal. And so, but anyway, it wasn't the femur, that big bone, and it wasn't the next big bone, the tibia. It was a crack in that fibula right there. Still painful, still needs to heal, and anyway, that was just an example. All right, here's a study of seated legs in a 3/4 view and skeletal diagram. So here we can see, here's the drawing, and then we see the skeleton in here. Here's that asus of the pelvis that we saw right there. The greater trochanter kind of sticks out a little bit. We see those flank pads up here. The patella sticks out. And you'll notice in these drawings, the shading is done in such a way sometimes to highlight these areas. Obviously, our knee is not going to be that bumpy, and these some of these areas are not going to show that well on somebody's knee. They might, but they may not. And but they're kind of enhanced for the drawing just so you can see them better. But anyway, the patella, tibial tuberosity there, the medial condyle, all these areas so that we can see them for using them for surface landmarks. And then the corresponding leg bones as well. All right, here's some drawings we see of the femur in a closed position. The femur's here, and here we see the tibia and the fibula. Here again we see kind of a lateral view here of the leg, the head of the fibula, and then the tibia, and then over here it just shows the locations as you're looking from different angles. Here we're looking almost from like maybe a 3/4 view. It's not straight on. The leg is bent just a little bit, but we can see that the fibula is over here on the left side. Over here as we're actually looking from a lateral view here. And now it's on the right side or kind of behind it. And then here as well, we can see it's kind of up there and behind it a little bit. So, all right, in the foot, we're taking a look, the ankle. So here we have the fibula and the tibia feeding down into the ankle. We have this bone called the talus tarsal bone right here. And so here's a good view of it. This red highlighted bone right there is the talus tarsal bone. And you'll notice, so there's the medial malleolus, the lateral malleolus, sticking out in either up or down. And you remember what this bone is called here? This heel bone? The calcaneus. And then here we have tarsals, and then here we have metatarsals, and then our toe bones are called phalanges. All right, let's take a look, the next picture. Here we see all of those. There's the calcaneus, the heel bone. There's the talus, the tarsal bone. Now each one of these bones here in our ankle, just like we had 8 bones in our, we have 8 bones in our wrists. We do have multiple bones also in our ankle. And so here's 3 of them that we see right here. 1, 2, 3, and they're labeled and numbered. And they also have their own names. Here's the navicular tarsal bone, the cuboid, which is also a tarsal bone. And then the metatarsals are labeled 1 through 5. 1 starts off with kind of your big toe and goes through 5. And then the phalanges are the little toe bones in there. So notice just like our fingers, our 4 fingers have 3 bones each, but our thumb only has 2 bones. It's the same in our foot. Notice that each of the phalanges, there's 3. From our toes 2 through 5, there are 3 bones in here, but our big toe only has 2 bones, not 3. It's only got 2 bones in there. All right, so that's a lateral view of the bones of the foot. And here's a superior view, and these are labeled, colored and labeled for us to see them easier. The calcaneus, the talus. Here's the navicular, the cuboid, and then these 3 are called the medial, the intermediate, and the lateral cuneiform. Here's the tuberosity. It kind of sticks out. You can actually feel that bone in your foot. You can feel it, and you can kind of feel that ridge a little bit. Notice how it doesn't have a smooth transition there. You can actually feel that where it's not that smooth transition. And so the tuberosity of the 5th metatarsal, and then the metatarsals are labeled 1 through 5, and again the phalanges. Distal is the tip, and then proximal is the one closer to the foot. And then this one is just called the middle in there. All right, one last slide. You've made it this far. You've done great. And the vertebra, and we don't even need that slide. We're done. So bones of the foot. And hope you've learned some names of the foot, and of the leg, of the torso, of the arms, of the cranium. And remember those. Take the quiz, and see you next week.